So once again, I'd like to welcome everyone to this event. Thank you very much for joining us today. We're joined by Warden Frank Prevost, who will read a brief statement, and that statement will then be followed by questions from the media. So I turn it over now to Warden Frank Prevost.
Okay, thank you, Mr. Laihu, and good afternoon, everyone, and thanks very much for the attendance here today on probably short notice, but I've asked you all here today to help me convey to the deep frustrations we are feeling as rural communities in Eastern Ontario. Our residents have been through the ringer over the last 14 months. We have endured lockdowns, shutdowns, physical isolation, fear of getting sick, and concern that our local hospitals are bursting at the seams because COVID-19 cases are spiking. In the end, we are all fed up. We look on with envy as our other regions and countries, including our neighbors just across the St. Lawrence River in the United States, enjoying the benefits of massive vaccinations. Because Canada has been slow to roll out mass vaccinations, and because COVID-19 variants are entrenched in Ontario, we once again find ourselves in a shutdown. Just today, we learned that 10,000 vaccination appointments were canceled in this province due to the lack of supply. This situation is unacceptable to our residents, and we are here today to call upon the senior levels of government in Ottawa and Toronto, as well as our local MP and MPPs, to turn heartfelt words into concrete action. Our local health unit has begun the process of vaccination in our region. At last count, there was approximately 35,000 vaccinations completed by the Eastern Ontario Health Unit. More vaccinations are being planned at hospitals and pharmacies by the end of this current shutdown. The Eastern Ontario Health Unit has plans to vaccinate another 35,000. But the total eligible population within the Eastern Ontario Health Unit region is approximately 170,000. The Eastern Ontario Health Unit can only, I repeat, only vaccinate individuals when it has enough vaccines to do the job. I'm calling on the federal and provincial governments to do more to get an increased number of vaccines to our local health units so they can continue the good work that they are doing. There has been much made of COVID problems in Southern Ontario, and there is increased focus on other hotspots throughout the province. With all due respect to the terrible tragedy unfolding in the GTA, I want to ensure our voices are heard as well. It is the voice of rural and small city Ontario. I have to remind our political leaders in Toronto and Ottawa that our residents are just as vulnerable to the coronavirus, and our businesses are suffering just as much, if not worse, than those in other jurisdictions. I further call on senior levels of government to level with us. We keep hearing that there is a light at the end of the tunnel, but this seems like an awfully long tunnel. The yo-yoing our residents have been forced to grapple with the last few months is unacceptable. In one breath, we are told vaccines are coming and hope is on the horizon. But at the same time, some vaccine clinics are being canceled due to the lack of supply. Schools are shuttered and businesses are closed. This is very confusing and frustrating, and our residents deserve the respect of straightforward answers without unnecessary spin. Our business owners have been forced to grapple with an overwhelming amount of change in recent weeks. They need a greater understanding of what is to come in the months ahead and better support to keep their doors open right now. I've heard directly from businesses in SDG some of whom tell me they are falling through the COVID cracks. Some businesses, which opened just last year, cannot get support because they are unable to prove a sustainable income over the last 12 months. Tell me, how is that fair? Our local economy is built upon these small businesses, and I look at our local barber shops and hair salons as an example. Why have they been forced to close an operation that can be limited to just 2 people who wear masks and liberally sanitize themselves? Yet I can go into a grocery store and be surrounded with multitude of individuals. What's good for one business should be good for all. Because it's disparity like this that anger our business owners and frustrates our residents. This pandemic is not new. We've been battling COVID-19 for more than 1 year. It's time for concrete plans that will lead us out of this pandemic as quickly as possible. And so far, unfortunately, I'm left with the impression that the tunnel I spoke of earlier continues to get longer and longer. Finally, I have a message for our residents. We understand your frustrations. You have been put in an impossible situation. As many of you risen to this challenge, but until we get the effective vaccinations in our region, I urge you to continue physical distancing, wearing masks, and you are our first line of defense. We need your help too. I want to thank each and every one of you for joining me here today, and I'd be happy to answer any questions that any one of you may have. Thank you.
Thank you, Warden Provost. I just want to remind members of the media who are attending today's virtual press conference, if you've got a question, simply click the raise hand option, and you'll be permitted access to ask that question. And once again, just a reminder as well, when you ask a question, please state your name and the news outlet that you represent, and we'll get to your question. So Warden Provost, the first person, or the first journalist, I should say, asking a question today is Philip Blanchard from the Morrisburg Leader.
Welcome, Philip.
Hi, Warden Prevost. Can you hear me okay?
Yes, I can. Thank you.
Good. So my first question is, in SDG County proper, there is only 1 pharmacy offering vaccinations. If you add in Cornwall, that's 3 pharmacies. Our neighbors in the riding next door, Leeds Grenville, has 6. Both MPPs are a member of the government. You're calling the vaccination situation unacceptable, and many would agree. Do you believe our local MPP, Jim McDonnell, is doing a good enough job advocating to get more pharmacies in SDG to deliver shots?
Thank you for your question, Philip. My understanding is our MPP, Mr. McDonnell, has been pressuring the province over the last week or two once we learned that we weren't getting vaccines in the SDG and Cornwall area. I understand that we will be getting some in the at least in the Cornwall area, but unfortunately, they can't open until the supply is there, and that's the issue across this whole press conference today, is that we do not have enough vaccines to support our local areas in regards to the ones that the pharmacies, drugstores, so on, that can give out the vaccines. There's no supply to do so. So yes, my understanding is between himself and the health minister in Toronto is that they're pushing for more drugstores to be given out the vaccines, but we need the vaccines to supply them.
Okay, thank you. And for follow-up, according to the EOHU, 72% of all cases of COVID-19 currently are variants of concern. Our region is above the provincial average for test positivity, and we're top 5 in the province for variant spread. The highest source of spread in the community has been private gatherings. That was evident over the Easter weekend, where we had a huge spike the week after. What are you going to do as warden and as SDG counties to increase the enforcement through bylaw or OPP to enforce some of these current public health restrictions that people are either through being tired of restrictions or just blatant disregard are disregarding these restrictions?
Yeah, well, thank you for that question also, Philip. And it comes down to how much staff we have in each municipality to support and go out and either fine these people for not following the rules. But I think in my personal opinion, as the warden of SDG, I think the province is looking at it in a different way when it comes to rural Ontario. I think, it always comes back to where our numbers are coming from. And like the comment that you made, it seems that the cases are coming from people that are gathering. So I think they're hurting the wrong people. I think they're hurting, our barbershops, our hair salons, our local small little businesses that can occupy 1 or 2 people in their establishments. That's not where our cases are coming from. They're coming from people gathering. In my personal opinion, if they want to stop gatherings, then the province, instead of putting a lockdown and people, to stay at home order, I think they need to put a curfew on the residents across the province and saying, you need to be home by 9 p.m. And if you're not, if you're out there, there will be a fine, which could be a drastic, number, which could be $1,000 fine if you're caught after 9 o'clock for not essential reasons. And there's ways of getting these people to pay those invoices if they don't, believe that they have to pay the $1,000. Their driver's license doesn't get renewed, or their sticker, or their vehicle, or whatever. So there's ways around it. But I'll be honest, and I'd be honest right up front. I have 3 teenage daughters that are 20, 19, and 16, and I'll tell you, it's I do everything in my power to keep them at home as often as I can. But there's times that they want to be out and they need to be out with their friends, and they sometimes they are gathering, so they're not better than anybody else. But the only way I'm going to be able to keep them indoors 24/7 is by having a curfew out there, and I think that's the answer in regards to it. But by hurting and suffering our businesses, I don't believe is the answer. I think these businesses need to get reopened, and reopened today.
Thank you, Warden Prevost. Our next question comes from Nick Seabrook at the Seaway News.
Welcome, Nick.
Hi, can you hear me okay?
Yes, we can.
Great. So my question is about support for small businesses. I was just wondering, have you spoken with the MPP about any sort of further support for small businesses to help them get through the current lockdown? Is the counties considering any sort of grant or funding program?
Yeah, so no, I haven't had that opportunity to speak with our local MPP in respect to that. I know there's some grants out there that small businesses can go after. I believe there's a $40,000 number. It's the support. We need more support for them, but we need also support for the ones that opened in the last 12 months. Obviously, for the $40,000 grant, you have to show numbers from previous years in regards to what your income was versus going through the COVID-19 process, showing that you lost income, so that those numbers are easy to provide when you're in a business for 2 to 3 years. But in this situation, when there's businesses open for the last 12 years, they don't have sustainable numbers to provide to get some of that type of income. And the discussion at the county level, it's we did receive COVID-19 funds from the province and the federal government, but there's only certain things that we're allowed to spend those dollars on. And I'd have to get more clarification from our county level that if any of those numbers, the funds that we did receive are eligible for any of those type of businesses. But I was under the impression that the answer might be no to that, but I'll get clarification in respect to that.
All right, thank you very much.
Thank you. Next up is Francis Racine from the Standard Freeholder.
Welcome, Francie.
Hi there, Frank. My question is in regards to hotspots. Do you believe that with our numbers, we should be marked as a hotspot in SDG in Cornwall?
Yes, I do. So listening to the CEO at the hospital and listening to Dr. Paul and where our numbers are situated, I mean, as of last night, our numbers decreased a little bit, but based on our numbers, based on our population in Cornwall, SDG, and Prescott Russell, excuse me, it probably looks like or recommends that we're into a hotspot area. So that's the interest part for me, is that if we are in a hotspot area, why are we not receiving more vaccinations to get us out of that hotspot and to get our numbers down? And again, I certainly don't want to bring vaccination numbers away from anywhere else in the province, but I don't, it just comes down to the lack of vaccines, and there's not enough supply of vaccines to get anybody out of the hotspots at this present time. When they start closing down facilities because there's no vaccinations to give out, and canceling, what was it, 10 or 12,000 people, 10,000 people, they had to cancel their appointments because we don't have enough vaccines to supply to them. And that's my biggest concern and my biggest issue. The only way we're going to get out of these hotspots or out of this completely and get our businesses back to play is by receiving more vaccinations, and it's up to the upper levels of government to push and as fast as they possibly can to provide those numbers to all our communities in the province of Ontario and across the country.
All right, sounds good. Well, thank you, Frank.
You're very welcome.
Warden Prevost, we have a follow-up question from Philip Blanchard at the Morrisburg Leader.
Thank you. Go ahead, Philip.
Hello again. Just to clarify your answer to my second question about calling for a curfew, are you actually calling for a curfew instead of some of the other restrictions, similar to what Quebec is currently doing as part of its public health measures?
Well, it's a two-part thing, right? I mean, if our health unit is telling us that our numbers are increasing because people are gathering together, then yes, if that's the answer, and if that's the reason why we are getting our numbers quite high, and if it's the only way of getting our numbers down is trying to keep people apart, then a curfew might be the answer. Because like I said earlier, my kids do go out and visit their other kids and friends and so on. So I presume that they're gathering with more than 2 or 3 people. So to me, if you want these people home, at 9 o'clock at night, then put a curfew on them so that they are home, and we can hopefully try and get our numbers down. Because I think, we're going after and we're suffering the wrong people. Our barbershops, hair salons, small businesses are the ones that are suffering because people are outside gathering together, which makes it very, very frustrating. So if that's the only way to get our numbers down, then yes, I would be in support of having a curfew on at 9 p.m. at night, and make sure you're at home unless it's an essential reason while you're out.
Okay, thank you.
You're welcome.
This is a last call for questions from the media. If there are no more questions, we'll turn it over to Warden Prevost for some final thoughts. Are there any more questions from the media? If so, please raise your hand. Warden Prevost, at this time, we appear to be wrapped up as far as media questions is concerned.
Okay, thanks very much. And I want to thank the press for being on here again today. And I hope this message gets out to across the province of Ontario and obviously to our federal governments. I think they need to take the lead very seriously and strongly in respect to understanding, the Eastern Ontario and rural communities across this province. That we need vaccines, we need our businesses back open. And like I said earlier, we're affecting the wrong people. Closing down a barbershop where 1 or 2 people could be sitting in there getting a haircut, I don't think has anything to do with the increased numbers in our area or anywhere across this province. So I'm asking, hopefully the mayors and wardens and members of council across this province to follow my lead and do a very similar type press conference, forcing our upper levels of government to do what they need to do to get vaccines in the arms of people across this province, but not only for us, but even across this country, so we can move forward. It's a disgrace in regards to the numbers. If we look at, we're just over, in Canada, we're approximately 37 million people in this country, and just over 716,000 are vaccinated with their 1 and 2nd shot. That's a 1.8% of the population that have been vaccinated across this country since we began. That is a disgrace to this country, and it's unacceptable. And if you look at the United States, there's over 800 million people in the United States. They have 75 to 77 million people vaccinated with their first vaccine and their second vaccine, and that's a large number in respect to their population. Their numbers are vaccinated, which is double of the people that we have in our own country, and we can't get 1 million people vaccinated by the end of May, which is a sad situation to see. Even when we look at Ontario, the numbers in Ontario are approximately 14 million people in Ontario. And I don't recall, I don't have that form with me, and I apologize, but it's 2.2% of the people in Ontario have been vaccinated, with their first and second vaccination. So it's unacceptable to our residents. It's unacceptable to our businesses. Mr. Ford and his team in Toronto, I give them a lot of respect. They're doing everything they possibly can under the circumstances, because it's new to everyone. But it's time that they have to relook at reopening our businesses as soon as possible. There's no reason for outdoor patios at restaurants in special rural Ontario, where there's not another patio within 3 feet from them. You know, I think they need to relook at that. I think they need to look at our small businesses. You know, these people spent lots of dollars over the last months to be ready to be open, to be COVID protected for themselves, their staff, and for the people coming into their stores. And then once they do all that, then they end up getting shut down for 28 days. Our economy cannot afford it any longer. We're going to be losing businesses in our communities. And as we all know, in rural Ontario, we don't survive without our local businesses in our rural communities. So again, like I said, I'm hoping that other municipalities and mayors and wardens across this province follow my lead and make sure that they get out and do some type of a press conference to continue forcing the provincial and the federal government to work together to get as many vaccines to our country as fast as possible so that we can wrap this up as quick as possible. And before I end, in a comment that I had earlier, was that our residents and businesses deserve the proper answers. You know, I keep hearing that, you know, the vaccines are coming, there's a light at the end of the tunnel. I don't see that light at the end of the tunnel at this present point in time. But I think the federal government and our premier of the province needs to come right out and state exactly where we are in respect of where we are with the vaccines, where we're going to be over the next several months throughout the summer, and when they believe this whole province and whole country will be completely vaccinated, and when we will be coming back to hopefully some very close to normal operations so that we can get back to a normal life. But by telling people, you know, they're coming, and there's light at the end of the tunnel, people are, you know, calling me and telling me that they're fed up of hearing those stories and they want the real answers. And I think it's time that the province and feds make it clear and give our residents the real answers. So thanks very much. If there's nothing or other questions, I appreciate everybody being here with us today.
Thank you, Warden Prevost. This concludes